Maha ma'am.
Yeah, it's ma'am. Good evening and warm greeting to all of you present here. There is endeavor to make the contribution towards achieving academic excellence. St. Joseph College of Engineering takes an immense pride in organizing the three-day international FDP Frontier of Physics in Biomedical Application. I am very happy to mention that our department stepping again into the next step of success. Now, at this juncture, I am A. Mahalakshmi, Department of Science, St. Joseph College of Engineering, would like to thank each and every one of you for being here with us today. First of all, I thank the God Almighty for making this FDP a great success. I happily extended my heartfelt gratitude to our chairman, St. Joseph Group of Institution, Dr. B. Babu Manokaran sir, for his guidance in making this FDP a resound success. I take this opportunity to thank our beloved Managing Director, Mrs. S. Jessipriya Madam, and Director, Mr. B. Sashishekar sir, for supporting us in all the way they can. I would like to acknowledge my sincere thanks to our respected principal, Dr. Buddy Seshagari Rao sir, Dean Dr. B. Parvadavardhini Madam, for always supporting us in all we do. Our head of the department have been encouraging and very supportive throughout the planning and implementation of this FDP. We as a team would like to thankful for the convener Dr. V.N. Nandini Devi ma'am. It's a inspiration. Inspiration is great. To be an inspiration is an honor. It's my great privilege to welcome our most valuable chief guest, Dr. Gokul Timarayan, USA, for this grand three-day international FDP program. With the joyful heart, it is a great honor for me to welcome you, sir. To all the faculty here with us today, your participation as educator is greatly needed to enrich the life of many students. Thank you all for the support and participation. Have a great session ahead. Now I welcome Dr. S. Kripa, Associate Professor of Physics, to introduce our chief guest.
Yeah, good evening, friends. I'm very happy to have Dr. Gokul with us. We know that in this pandemic period, all the doctors are working tirelessly. But even in his busy schedule, he accepted our invitation readily, and he is here with us in the early morning. And he's not new to Chennai because he has started his medicine as a life career from Stanley Medical College, and he did his specialized subject in anesthesia. Now he is in Marshfield Medical Center as an expert in anesthesia and intensive care division. He has traveled many countries and worked with many hospitals. So more than 20 years of experience and expertise with us. It's a great pleasure for us to have to listen to a talk from him. Good evening, sir.
Good evening,
Now the
everybody.
screen is yours.
Yeah, hello. Hope you're all doing great. And I thank for this opportunity. And I thank every one of the organizers and the conveners to make this program happen and coordinating with me and making it happen with a time that would be convenient for me as well. I really thank every one of you. And being as an anesthesiologist, physics plays a significant role in the practice of anesthesia and critical care, not only in anesthesia and critical care, in every aspect of our routine life, and starting and further extending into medicine, physics plays a key role. And with the topic of application of physics principle in clinical medicine, I'm just going to go and have an overview of how physics helps us in taking care of patients. And when we're talking about physics in medicine, it's usually discussed.
Excuse me, sir. Your PPT is not visible. Please check it, sir.
Okay, just a second.
Is it in, slideshow? Yeah. Yes, sir. Yes.
Is it there?
Yeah, now it is seen, sir. It is visible.
Thank you. I thought it was in the play mode. Yeah. Okay. So when we discuss about physics in medicine, usually we focus most on the three entities: diagnostic imaging, where X-ray, computerized tomography, MRI, and ultrasound is used in radiological imaging, and also in the nuclear medicine, where the PET and SPECT scan and various other modalities with radioactive isotopes are used in imaging and treatment, and as well as in radiation oncology, where ionizing radiations are used in treating cancer patients. So usually physics in medicine is discussed on this topic. But as I mentioned before, physics plays a significant role in each and every day of our life, and as well in clinical medicine. I'm going to focus the discussion on in the clinical medicine how physics helps. So here is a picture of an intensive care unit where we see an array of gadgets all around the patient. We could see in the middle of the screen, there is the ventilator to which the patient is connected. And to left of the screen is the stack of infusion pumps with various medications. And on the right is the dialyzing machine. And on top is the monitor, where we could see like n number of devices there, which each and every one is based on physical principle, without which taking care of patient in an efficient way would not have been possible. And also the progress of medicine throughout has been possible with the progress and a new invention and discovery in physics. And the next slide is a picture of a modern operating room. Once again, another array of gadgets here with X-ray, microscopes, and the stereotactic sensor device, and multiple other machines, which is all based on physical principles. And apart from this high-tech operating room and intensive care unit, when we go for a day-to-day clinician visit, whenever we are sick, in the medical examination room, where we see in this picture, there is a ear examination device and an ophthalmoscope and an EKG machine and few other stuff which is used on a daily basis in a doctor's office. Even the small devices which is used on day-to-day basis has physical principles involved in it. And just to go on one thing, like stethoscope from our childhood, which we will recognize with a doctor, this device, it works on the base, has a physical principle involved in it. When the chest piece is placed on the chest, it conducts the sound from the chest, the breathing sound and the heartbeat. The sound of that hits the diaphragm of the chest piece, and the sound is conducted as a wave through the hollow tube and reaches the physician's earpiece, which gives the information of the cardiac sound and the breathing sound. So the conduction of the sound through the hollow tube is the principle where that gives the clinical information to the physician. That's a small device which is used on a regular basis. With the simple principle of physics, it makes things happen to help the patient. So to starting from this, physics plays a key role in every aspect. And to discuss about how physics helps, I thought of discussing with a clinical scenario. So that would give a better perspective how it influences in the day-to-day practice of clinical medicine. So being the times with Corona, so I thought of taking a clinical scenario with that as an example, and how the patient presents and how the patient is treated, and in the way of treating, how the principles are getting involved. We could discuss about that. And along with discussing each principles and various other applications, we could also include at each juncture. So here is a hypothetical scenario where a 60-year-old patient comes with all classic signs and symptoms of having infected with Corona, and he also tests positive and he has some breathing difficulty. And he comes to the hospital where the clinician there, he checks him with a pulse oximeter and he finds it to be 86%. And so the clinician decides to put him on oxygen. And after treating him with oxygen and other supportive measures, he decides to check how the patient is doing. So he does a blood gas analysis, which seems to be not in a progressing in a good way. So the clinician decides to put him on a mechanical ventilation to support his breathing. And the patient stays on the mechanical ventilator for some days. And to facilitate ventilating and concern of being on ventilator for some time more, the clinical team decides to get him a breathing tube in his trachea. And after a period of time with no further progression and his lung is not doing well, there's need for artificial lung, which is done with extracorporeal membrane oxygen. So the patient goes on that. So let's stop here with the clinical scenario of till the patient goes to the ECMO. So from the time the patient comes and his blood oxygen assessed with the pulse oximeter and how the treatment progresses. So in each and every point, how this is done, how this is evaluated and getting treated, and how the physics principles are involved in it, we could discuss one after the other. So as I mentioned, the patient comes with breathing difficulty, and to assess his blood oxygen, a pulse oximeter, which it becomes a common device, like as we have a thermometer and blood pressure instrument in our home, we also have pulse oximeter at our home nowadays. So how this pulse oximeter works? So the pulse oximeter is put on a finger or any extremities, where in this device there is a light emitting source and a sensor on the other end. So there are two different light wavelengths. When it passes through the tissue and the blood, the light gets absorbed based on the path which it travels and also the nature of the material which passes through. The light that reaches the detector, it gets varied in its, the amount that sends, it gets varied from different from the source, it is how it is. So the variation in the from the source to that it's sensed in the detector, that helps in calculating the amount of oxygen in the blood, and which is calculated and given as a percentage of saturated oxygen saturated in the blood. And this is based on the physical principle Beer-Lambert's law. So the light gets attenuated as it passes through a material, and the amount of absorption, it depends on the concentration or the nature of the material that it passes through, the tissue and blood in this case, and the path length that it travels. So in pulse oximeter, there are two wavelengths of light utilized. One is the red light and the other is the infrared light. The infrared light absorbs oxygenated infrared is absorbed by the oxygenated hemoglobin, while the red light is absorbed by the deoxygenated hemoglobin. So with the variation in from the source, and it's directed at the point of detection with the after absorption, the difference gives the saturation. And the same principle could be used to measure the carbon dioxide level and the bilirubin, and also in the anesthetic gas analyzer. So the day-to-day use which is used clinically now, the pulse oximeter, it works on the principle of Beer-Lambert's law with attenuation of the light when it passes through the material. And similarly, the same principle, it's used in, it could be extended. So instead of using the two wavelengths in light, multiple other wavelengths are utilized, like up to 7 wavelengths of light is utilized. And when it passes through the tissue, with the variation, the absorption, and the amount of light that reaches the sensor with the different wavelengths, it is extrapolated, and it's able to calculate the amount of hemoglobin present in the blood. Hemoglobin, carboxyhemoglobin, various other methemoglobin, all this could also be calculated. And this is pulse co-oximetry. It's essentially the same. Instead of using the two wavelengths, multiple more other wavelengths of light are used to get the information. So this pulse oximeter and co-oximetry, it gives the amount of oxygen and the hemoglobin and the various other forms of hemoglobin in the blood. Similarly, blood present in the oxygen present in the blood, whether it reaches the tissue. So the same principle is utilized to check the tissue oxygenation in procedures like the patient where undergoes in surgical procedures where like cardiac bypass surgeries, where the surgery is done in the deep hypothermic circulatory arrest, and technically there's no perfusion through the body, that the heart is totally stopped, and the surgery is done when the heart is totally stopped and the body is totally cooled. But the rest of the body, it will be okay with no blood perfusion for a certain amount of time. But to be sure, but the brain is very sensitive. To make sure, even at the hypothermic circulatory arrest with the low temperatures and with selective perfusion to the brain, the amount of oxygenated blood that reaches the cerebral circulation, whether it perfuses, it reaches the oxygenation, reaches the tissue, it could be assessed with the near infrared spectroscopy, where it's essentially the same as in the pulse oximeter, where in the top of the picture we could see there's a mention of emitting optors, where there are the light source, where it emits the light and it passes through the skin, skull, and it goes through the brain tissues. Unlike in the pulse oximeter, where the sensor is placed right opposite the light emitting source, here the sensor is placed distally. So the sensor detects the scattered light. So when it passes through the tissues and receives the scattered light, the variation in the light wavelength which it receives after passing through the tissues, from that we are able to calculate the amount of oxygen in the tissues. So it's a step further in detecting the tissue oxygenation apart from checking the saturation of oxygen in the blood. So this principle, Beer-Lambert law, with absorption of wavelengths through the material, this principle is utilized in multiple other scenarios with pulse oximeter, co-oximetry, and in this near-infrared spectroscopy. So the patient has come with a clinical scenario, just to remind it back. So the patient came, we checked with the pulse oximeter, and we discussed the physical principles involved in it. So now the clinician, as I mentioned before, decides to treat him with oxygen. So oxygen is a medical gas, and there are also various other medical gases: nitrous oxide, carbon dioxide, helium, compressed air. These are all used in clinical practice. So these medical gases, in this picture, this is a nice picture where it shows like a transparent see-through view of a hospital, where in this picture, in the right bottom of the screen, where we see a gas storage tank, and further extending further, we see the manifold of cylinders, and to the left of the screen we see compressors and suction machines, and from which all the tubing goes through from the central manifold. It goes into the hospital at the various locations where it is utilized, to the ICU, in the operating room, and also in the patient floors where oxygen is used in the treatment of the patient. Not only oxygen, all the other medical gases based on the situation where it is used. So this medical gases, from the point it's used in the therapy. So from the point of its manufacturing, either by distillation, concentrators, or like multiple other methods, and from the point where it is produced to the point it is where delivered in the hospitals or clinical scenarios where it has to be utilized, it is stored in the cryogenic form, so that where like more volume of gas could be stored or transported in a low volume space, and also the high pressure compressed cylinders. And after reaching to the hospital, from dispensing it from with a very high pressure storage space to getting into the clinical environment, the pressure is reduced to the intermediate level, where it is between 40 to 60 psi, and from that to the clinical level, the pressure is reduced to less than 21 psi, where there are pressure monitors all the way, control panels to regulate it, alarms, and pressure relief valve to prevent any explosion and keep the process safe. And in all this process, and also the amount of gas that is utilized, and after utilizing it, how much is remaining in the storage and how long it would last. So that this calculation, in all this process, physical laws are involved, like all this gas laws, Boyle's law, Charles Gay-Lussac's law, ideal gas law. Every one of these laws involved in this process. Going into, I believe we don't have to discuss about each laws in like how it works and how it goes in, but to give an overview, to treat the patient with oxygen or other medical gases, there's a whole lot of process. Just the patient comes with a breathing difficulty, we put on an oxygen, and it helps the patient, and the patient feels better in breathing, and he gets well. That's a great thing. But behind that, from the process where it's manufactured, it's transported, and in the hospital how it is dispensed, there's a whole lot of steps involved. In each of the steps, to keep it safe, efficient, and effective, there are multiple physical principles involved. Like that's all the gas laws. And so, okay, that oxygen is now reached to the clinical scenario, to the side of the patient bed, and we are using it to treat the patient. So we might have seen the oxygen mask applied on the patient's face. So we don't want to use 100% oxygen. Like when we open up the oxygen cylinder, or from the central pipeline, we connect the oxygen mask with the tubing and we give the oxygen. we don't want to give 100% oxygen all the time. 100% oxygen is used almost like where the patient is kind of very sick and he could not breathe any more like air with oxygen. I mean, like oxygen. He needs 100% oxygen, to put it simple. So like most of the time we don't need 100% oxygen, and also 100% oxygen is also toxic. So we need to decrease the percentage of oxygen, and of course it could be made possible with devices and gadgets to mix it with the air or other gases, medical gases as needed. And but with the help of the Venturi effect, which is based on the Bernoulli's theorem, it is made very efficient and simple. So in the picture on the image on the left side of the screen, we see a mask, and there is also a sub picture from it. So what we do is, like, by keeping the flow of oxygen, which is 100% oxygen, just like a little, like a liter or 2 liter or 4 liter, based on the percentage of oxygen which we want to deliver. So this oxygen that reaches, it's allowed to pass through a narrow constriction. So when it passes through a narrow constriction, what happens is when it passes beyond the constriction, there is increase in velocity and a fall in pressure. And this fall in pressure, what it creates, it entrains the room air. So the amount of, when the room air that is entrained into the tubing, what it happens is it mixes with the 100% oxygen, and the concentration of the oxygen comes down to the extent what we need. So by designing the constriction based on the entrainment ratio, how much amount of air could be entrained, we could decide the percentage of oxygen that we could use to treat the patient. So the simple mask that we put, and we see hear the hissing sound whenever the oxygen is flowing onto the patient's face, is a simple thing. But like in that simple thing is an efficient physical principle which helps us in achieving the target of treating the patient with the desired amount of oxygen. And similarly, patients with asthma, we might be seeing them getting nebulized with the medication. So like we see the fumes of medication getting given to the patient through the face mask or through the nebulizer unit. So it follows the same principle. The compressed air or the oxygen that comes to the tubing, when it passes through the constriction, there's a chamber there. In the image on the right, we could see the picture mentioning as a chamber. In the chamber, if we put a liquefied medication in there, so when the pressure distal to the constriction drops, this medication, liquid medication, they gets aerosolized because the low pressure sucking in, this medication goes in and it mixes with the oxygen or the compressed air, and the medication is nebulized into aerosols, and the patient could breathe through it, which helps in making them feel better. So the principle that involved in that is Venturi effect derived from the Bernoulli's principle. The same thing that I mentioned, the entrainment ratio decides the percentage of oxygen that we want to give to the patient. Entrain flow by the driving flow, which is used in the same Venturi mask, nebulization device, and also the jet ventilation during the emergency situation when we have to inject oxygen straight into the trachea through a cricothyrotomy or a tracheostomy. The jet ventilator is used, which also utilizes the same principle. And the other principle based on the gases, the helium is is used in medical applications, and helium is a gas known for its very low density. So this property of helium with low density is utilized in treating patients with severe airway obstruction. A patient with very severe asthma who is not responding to medical treatment, like either for nebulization or other medications, epinephrine, any other medications. So to make sure that the oxygen passes through the obstruction and reaches the alveoli so that the body gets oxygen, the property of helium with low density is utilized. So with the low density, the flow of helium is laminar, while the turbulent flows, when the air passes through the obstruction, like in this image on the left, we see there is two circular cross-sectional images of trachea. The one above is a normal one where there is not much of obstruction, and the one below where there is tissue edema. And here in this picture, there's not much of an obstruction, even though it is obstructed than the picture above. In real clinical scenario, there are situations like where there will be total occlusion of the trachea and bronchi and other airways, where literally oxygen, when it go and passes through the narrowed pathway, it creates a turbulent flow, and the amount of oxygen passes beyond the obstruction is almost nil. In that scenario, oxygen and helium is mixed and administered to the patient. So being mixed with helium with low density, when it reaches the obstruction, the flow is less turbulent and it's more laminar, which allows the pass through the obstruction, and the patient gets better when the oxygen reaches beyond the obstruction, distal to the obstruction. So it's based on the principle of Reynolds number, where the Reynolds number, it's a number below which certain number less than 2000 is laminar, more than 2000 is turbulent. There are various factors that decides the laminar or turbulent flow: density, viscosity, the dimension of the passage through which the gas has to flow. All these things determines the flow pattern. So the low property nature of the helium is utilized, low density property of the helium is utilized in this clinical scenario. And also there's other clinical situation where helium is utilized. It's an intra-aortic balloon pump. Patient's heart where it's failing, it can't pump blood efficiently. In those scenario, when the blood has to reach to the vital organs first, like to the brain and the heart itself. In that scenario, in the failing heart, as a temporizing measure, a balloon is inserted into the aorta, and it's placed at the right position. And every time when the heart pumps, the balloon is not inflated. Like the extreme right end of the screen on the slide, there's a picture where it's mentioned as the heart picture, below mentioned as systole. It's the time where the heart contracts. So at the time of contraction, the balloon is deflated. It's not inflated. So the blood comes out of the heart. Right after the heart contracts, when the heart relaxes, instead of letting the blood go through the distal part of the body to make sure it perfuses the brain and the heart, the balloon gets inflated. So the vital organ is perfused. And in this inflation, helium is used. And once again, helium with this low density, it's easy to cycle every time to inflate and deflate, inflate and deflate. We could use oxygen or carbon dioxide, but compared to those, helium has a low density, which makes the cycling process efficient. And that's why helium is used in this process of intra-aortic balloon pump, which is a life-saving measure in patients with severe heart failure. And next comes the other clinical scenario here. And patients, workers who work in caisson chambers, which are like high pressurized chambers with high temperatures and high pressures, they work. It's usually the caisson chambers are used for underwater constructions or underwater bridge constructions. When people work there and when they come out, they get sick and they almost lost their life initially in early days. People had no clue why it is happening. And also similarly, deep sea divers. So when they die, they go down, and when they come up, they get stroke and they get a heart attack, and they have very bad pain in their joints. So earlier days, it was not known why it is happening, but it was then later realized that on the surface, when we are on the surface of the earth at the normal atmospheric pressure, nitrogen, which is predominant, like 70% of more than 70% in the atmospheric air, it stays in the gaseous state. It does not diffuse into the blood. But when the workers who work in the caisson chamber or the deep sea divers, when they go deep in under high pressure, and under the high pressure, it gets dissolved into the blood. And the dissolved nitrogen stays there. But like when they ascend up quickly, what happens is like the pressure comes down and the nitrogen bubbles out. If they ascend gradually up, it will dissolve out, bubble out, and it could be breathed out through the lung. But when they come up quickly out of the caisson chamber, or the deep sea divers come up quickly to the surface, the oxygen bubbles out, and it bubbles out, it could block the circulation to the brain or to the heart, and it could bubble out in the joints, causing very bad pain. And this is essentially nothing but based on the Henry's law. Gases gets dissolved at high pressures, and it varies with temperature. So the Henry's law gives us an idea like why it happens. And the same could be utilized in treating these patients as well. So like when they are ascending out of this deep diving or from the Kaizen chamber, gradually reduce the pressure and gradually coming out will help in avoiding this disease. And the similar principle is used in hyperbaric oxygen therapy. So tissues where the oxygen is not reaching, or in clinical condition where high amount of oxygen is needed, by putting the patient in this hyperbaric chamber, higher concentration of oxygen at higher pressures, it diffuses into the tissues and it helps the clinical scenario. For example, there is a infectious condition caused by a bacteria, Clostridium perfringens, where it causes necrosis, like that's the tissue death. In that condition, this bacteria is totally anaerobic, and when the tissue is dying, there is almost vascular supply is compromised. By putting those patients with this infection in the hyperbaric chamber and giving oxygen under high pressure, the oxygen gets dissolved into the tissues. Despite not having blood flow, the oxygen gets dissolved into the tissues. I mean, like not total absent, like not efficient blood supply. Oxygen gets diffuses into the tissue and it helps killing the bacteria. And also the infection of the bones called osteomyelitis, where it's very resistant and it's difficult to treat the infection. In that case, this hyperbaric oxygen therapy, it helps. And also in carbon monoxide poisoning, because carbon monoxide has 100 times more affinity towards hemoglobin than oxygen. So by having the higher pressure oxygen, it helps displace the carbon monoxide from hemoglobin and helps treat the carbon monoxide poisoning. So the Henry's law principle, like with higher pressure, the gas gets dissolved. Solubility of the gas in a liquid is proportional to the partial pressure of the gas above the liquid, and it varies the temperature and varies in temperature. So we see this law in how the disease, the Kaison's disease or the deep sea diver sickness disease happens, and it's also used in treatment of it and in other clinical scenarios. And in the laboratory, when the blood gas sample is sent to analyze the components of it, the amount of oxygen and other parameters in it, and when we collect the blood, if there are few air bubbles in it, based on the same principle, it could give us an erroneous result. And also when we are analyzing the patient blood gas in a different clinical scenario as the patient in cardiopulmonary bypass, where the patient is cooled, once again, the amount of the parameters that we get out of analyzing the blood at a different temperature, it's different from when it's analyzed at the room temperature. It's based on, once again, the Henry's law, why it happens. So we analyze check the patients, coming back to the clinic scenario hypothetical that we discussed before. The patient, we checked this blood sugar with the pulse oximeter, blood oxygen, we checked with the pulse oximeter, we saw the principle, how it works. And in treating him with oxygen, we saw the overall the medical gases and its principles and how it's utilized, and other associated clinical situation where medical gases how utilized and various physics laws how it's implied in it. And okay, like we did, but when we are giving a therapy, we should know what gas we are giving. There are chances of errors happening. There are catastrophic events where like the wrong gas gets connected to the different pipeline. In place of oxygen, nitrous oxide gets, or in the place of nitrous air gets misplaced. And so we need to know whether we are giving the right gas, right treatment. And also we need to know how much amount of gases we are utilizing in. Is it the necessary amount? Is it the amount appropriate for the clinical situation? So we need to know we need to identify the gas and analyze its concentration. So that could be done by various methods. And of the various methods, one is the paramagnetic analyzer, where those gas molecules with unpaired ions, they get influenced by the magnetic field. So when the sample gas is passed through the apparatus, and when it passes through the magnetic field, it gets attracted towards it and it starts spinning the dumbbell, which is this apparatus. Let's not go into discussing the features of the apparatus and how it works. So when it goes and passes through the analyzing chamber, it gets influenced by the magnetic field, and it creates a variation in the apparatus from which we could analyze the what kind of gas it is and its concentration. Based on the amount of gas in it, it gives us the concentration of the gas, and also we could identify the which gas molecule is in it. And the other method is infrared analyzer, and it works on the principle of Beer-Lambert's law as well. And here with this method, we could analyze and identify carbon dioxide, nitrous, and other volatile anesthetic gases. And when the sample gas, through the sample gas, the infrared light is passed, and it passes and it reaches the sensor, the amount of which it gets absorbed identifies the gas and the amount of gas that we are intending to analyze. And the other method is Raman scattering. So a laser beam is passed through the sample, and when it hits the sample gas, there's a change in the wavelength of the laser light that when it passes through the sample, and it hits on the diffraction and grating, and it's from the after it gets diffracted, it's detected in the sensor. So based on the nature of the molecule present in the sample, there's a change in the wavelength of the laser light. So with that, we could identify which gas molecule is present and that we intend to analyze. And also based on the amount of scattering, it gives us the concentration of the gas. And this is the Raman scattering principle used in identifying the sample, which gas and its concentration that we intend to analyze. And the other method is mass spectrometer. Here, the sample gas which we want to analyze is passed through the apparatus, and where it gets bombarded with the electrons, and the gas gets ionized. And this ionized gas is accelerated and allowed to pass through a magnetic field. When this ionized molecule passes through the magnetic field, it's deflected in a certain pattern which is unique to each gas type. So based on the deflection and the extent of deflection, it identifies the gas and its concentration. So these are the various paramagnetic analyzer, infrared, Raman scattering, mass spectrometer. So these are the various methods, the physical principles which we utilize to identify the gas and its medical gases and its concentration. And next comes the blood gas analysis. So after the therapy, apart from the pulse oximeter, to analyze direct from the blood the partial pressure of oxygen, carbon dioxide, and various other parameters. Literally, this blood gas analyzer machine, it gives hundreds of parameters. It gives almost everything. So the device on the left side of the screen, this is the standard blood gas analyzer machine which is used in the laboratories to do analysis and give the report. And the one that's iStat machine from Abbott Industries, this is a handheld device. It's put on its charger, but when we lift it, it's almost like a kind of a cordless phone, or a little bit bigger than that. This device, it gives the same 100 number of parameters when we have to analyze. And this device is used in emergency department and also in war fields. Like one of my colleague, he worked in as a anesthesiologist in Afghan war. He said that their whole laboratory is this one handheld device. So this devices are such efficient that it gives to the point accuracy, like hundreds of parameters. So where it could be taken and utilized in taking care of the patients. So all this is possible with the development in science and the physical principles involved in it. It's amazing, isn't it? So such an efficient device which could analyze and gives us hundreds of parameters, as similarly there are like hundreds of physical principles involved in it. To discuss it in detail, it would be each one would be a separate topic in its own right. So rather than discuss like just overall few common principles which is utilized in it to analyze and give us the results. So there are, to analyze the oxygen, it utilizes say that the Clark electrodes or polarographic electrodes, and there are fuel cells, paramagnetic analyzer, and there is Severing-Haas electrode, and with various electrolytes and solutions, IR absorption, UV analyzer, Raman effect, mass, all the things that we discussed before. All these things are customized and made it so efficient to get compressed into the device, where it does the analysis and gives us the report right away in like a couple of minutes. Once again to a scenario. So the patient's blood gas is 10 and it seems like the patient is not doing so well. So the clinical team decides to put our patient on the ventilator. And again, here is a picture where we see a patient is connected to a mechanical ventilator. In normal respiration, when we breathe, it's a negative pressure ventilation, which means that when we breathe normally, like when I breathe and all of us, our chest creates a negative pressure inside. So when there's a negative pressure inside, air from the atmosphere goes in and we get oxygenated. And when the lung contracts, the positive pressure helps exhaling the air. And this is how normal respiration happens. But while in mechanical ventilation, it's the other way around. Instead of negative pressure ventilation, it's a positive pressure ventilation, where from the machine end, there's a positive pressure generated, and this positive pressure drives the air through the ventilated tubing circuit, and it goes into the patient and it inflates the lung. So it's a other way around. So to have in the orange color picture on the right, the A side, that's the ventilator side, and the B side, that's the lung side. Let's take that's one alveoli, the basic component of the lung. So to have the air flow from the one end to the other end, there are various like parameters that decides how efficient it is. And by doing it in the right way, it would prevent first, it would give proper oxygenation, and second thing, it would prevent any trauma to the patient lung. It's not like pushing like n volume of air into the lung and patient gets oxygenated. It should be appropriate in accordance with the patient's physiology, where it would help the patient and it also should not cause any trauma to the patient. So the flow and the amount of gas, the oxygen and air that has to be delivered, it's basically the flow principle that is involved. So the length of the passage that it has to pass through, and the resistance it has in it, and the pressure gradient between the machining and to the patient lung, these are all the factors that guides it in giving the right tidal volume and keep it cycling so that the patient gets ventilated n number of times as needed per minute. And Hagen-Poiseuille principle is utilized in it. So like the kind of gas, the breathing tube diameter, its length, and the viscosity of the air, all these physical parameters decides like how efficient the patient gets ventilated without any harm to the patient. And to just mention about, there are various modes of ventilation and volume control, pressure control, synchronized intermittent mandatory ventilation, pressure support, high frequency jet ventilation, or oscillator ventilation. Each one of the mode is utilized based on the patient's clinical scenario. And to trigger the ventilation, whether they use the flow trigger or the pressure trigger, and to cycle with each breaths, there are various cycling variable. Either it could be volume cycle. Once the patients, let us say they put a 500 ml per breath as a volume, once this 500 ml of volume is delivered, then the machine would stop giving breath. Then it will give, after a certain set amount of time, it would start giving another breath. This cycling could be based on either the volume or the pressure which is achieved in the patient's lung, or it's based on the time. Like every 2 seconds, give oxygen and wait for another 4 seconds, then we give another. So like it's time cycled, and also a flow cycle. These are various parameters with which the ventilator is set to function based on the patient's clinical condition. So overall, to say, to effectively ventilate the patient, Hagen-Poiseuille law is utilized. It's the basic principle. It's not like the whole ventilator works on that law. It's just the flow of the gases through the ventilated tubing and through the patient's breathing tube and into the lung to effectively and efficiently ventilate the patient, which helps him and not harms him. And as I mentioned, so like after the patient being ventilated and he's being on ventilator for some time, and the clinical team decides to put him on tracheostomy, that instead of putting a breathing tube through the mouth, a hole is created in the trachea, which helps in effectively ventilating. That bypasses essentially the, like when the length of the breathing thing is cut down, so the resistance comes down. And also by having a breathing tube in the trachea, it helps in doing lung toileting. So this is a clinical thing, nothing much to worry about. What is a tracheostomy? It is nothing but a opening in the trachea, stoma opening created in the trachea to effectively ventilate and take care of the lungs. So it's a surgical procedure. To do the surgery, the patient has to be anesthetized. So when we talk about anesthetizing the patient, it could be done in many ways. And to talk about the physical principles involved in it, let's talk about the patient getting anesthetized with a inhalational anesthetic, which is with the anesthetic gases. So in the picture on the left, we see a anesthesia workstation, and the anesthesiologist is holding a mask on the patient's face and ventilating with the green bag there. And just behind the green bag, little above, we see there are two like canister like thing attached to the anesthesia workstation. So these canisters are the vaporizers. These canisters has anesthetic gas in it. So the anesthetic gas, these are very efficient. It helps in putting the patient to sleep, and also it should be done at an appropriate concentration, and if not, it could be dangerous. So to deliver the desired appropriate amount of anesthetic gas, this vaporizers, the canister like device there, the vaporizers are utilized. It's called as anesthetic vaporizer. And to the right, we see on the picture, we see the longitudinal section of the vaporizer. So how the anesthetic gas is delivered to the patient is, oxygen is allowed to pass through the canister, the vaporizer, where there's a bypass chamber. So in the vaporizer, below is the chamber where the anesthetic agent is stored, or it's put up there. So when the oxygen passes through that, there are molecules of anesthetic agent with vaporizers, and it stays in the surface of the container. So when the oxygen passes through it, it carries the anesthetic agent along with it, and it reaches the patient to anesthetize. So by titrating the amount of oxygen or air that passes through the vaporizer, we could titrate the amount of anesthetic agent that is carried along with the gas to reach to the patient. So in this process, the physics principle involved are the vapor pressure. So the vapor pressure, boiling point, and latent heat of vaporization, these are all the various physical principles involved in there. So like to stay in the state of equilibrium between the gaseous state and the liquid state, there's a constant molecules moving from either side. And there's the molecules that is in the gaseous state, when it is carried away by the carrier gas, oxygen and air, there's again some more molecule getting converted into gaseous state, and it stays. And it's based on the vapor pressure and also the boiling point of the inhalational anesthetic agent and the latent heat of vaporization. So all these physical principles are involved there to deliver the exact right amount of anesthetic agent to reach to the patient. If like it's just leave it, instead of not designing the vaporizer based on these principles, if we just have an inlet to let oxygen to pass through it and carry some, so there will be a whole bunch of anesthetic agent delivered to the patient, and literally it could kill the patient. So to render a safe anesthesia to the patient, the vaporizers are designed based on all these principles. And after the anesthetic agent, it reaches the patient, it reaches the lung, and it has to diffuse through the lung to reach into the brain, where the prime organ to put to sleep. So the blood gas solubility coefficient, the Oswald coefficient, based on this number, it decides which anesthetic agent, how much amount it could be utilized, and how potent it is. So the concentration of the compound in one solvent to the other solvent, that ratio. So when it reaches the lung, it diffuses across the lung into the blood. So how much it diffuses in the blood when compared to it in the gaseous state. And based on this coefficient, we decide on how much amount of anesthetic agent has to be delivered to the patient. And there are various other parameters like first gas effect, diffusion hypoxia. So rather than going deep into the one topic, basically to say, to render a safe anesthetic practice, physical principles are particularly keenly utilized to render a safe and efficient care for the patients. And once again, back to a hypothetical scenario. Now the patient is tracheostomized and he's on the ventilator for a while. Now it seems like his lung is not doing any good. So he needs a artificial lung, which is extracorporeal membrane oxygenation. In the picture, in the slide in the left, we see a image where the blood is drawn out of the, from on the neck side, we could see a blue color line coming out. That is, the blood is taken out of the patient's body, and we see a rotor machine where it spins and pushes the blood forward, and it reaches that's above. There is a oxygenator. The oxygenator has a semi-permeable membrane. What it does is like it allows the carbon dioxide, because when the patient's venous blood is taken out, it has more carbon dioxide. And this, through the semi-permeable membrane, the carbon dioxide is washed off and the oxygen is diffused in. And once again, it's put back into the patient's body. So now the lung, which has to, it is the function of the lung. When the lung is not able to do this, we do it with an external machine, which does the function. And something similar in the patients with renal failure, where the kidney does the function of removing the metabolic waste like urea, creatinine, and excess electrolytes and excess water, which is removed by the kidney. When the kidney fails, we take the blood out of the patient body and it passes through the dialyzing unit, which has once again a semi-permeable membrane, and it has a dialysing solution through which it exchanges the material. So let us say if the blood that comes from the patient body has more urea and creatinine, according to the process of through the concentration gradient, the excess amount of urea creatinine is removed from the patient body, and the excess water is also removed. And after removing the unnecessary metabolic waste, the patient's blood is put back into the body. That's the hemodialysis. So in both of this process, the concept of diffusion is utilized, fixed law of diffusion, where the rate of diffusion is based on the concentration gradient between the two sides, from the higher end to the lower end, and also the membrane thickness. It's a simple thing that we know, laws of diffusion, but this basic principle forms the key functional mechanism of either the extracorporeal membrane oxygenation or the hemodialysis unit. And also the same principle is also used in testing the patient's lung function, where the amount, it's another situation where carbon monoxide used in tiny quantity to check how efficient is the lung and how much amount of carbon monoxide could diffuse through the lung, and tested in the blood to see the effectiveness of the lung function. So in this process, fixed law of diffusion is utilized to take care of this patient. So overall, now coming to the, I mentioned, like, let's stop with this, like, because hypothetically, once again, the patient is on ECMO, and we presume and we hope that the patient gets better and he's off ECMO machine and his lung is function now and he goes back home. Good for everybody. So in the whole process of the treating the patient, right from oxygenation, checking him, monitoring him, treating him with various methodologies, and for him to getting better, there are a whole lot of devices used, and all of these devices are based on some physical principles which helps in taking care of the patient. So apart from this given clinical scenario, just few of the other situations where the physics are utilized, physical principles are utilized. So here is the invasive pressure measurement. Like usually to measure the blood pressure, a blood pressure cuff is applied on the arm when we go to the doctor's office, and the pressure is checked. That is done by the oscillometric method. But I thought of discussing this invasive pressure measurement, where like IV, a cannula is put inside the patient's artery, and it's connected to a tubing with fluid, which is connected to a transducer. And this transducer is connected to the oscillometer. And this transducer has a Wheatstone bridge, and it works on the principle of strain gauge. So with every time when the artery pulsates, this pulsation travels through the tubing. There's a change in the pressure in the tubing through the liquid column, and it pushes on the transducer. And when it pushes on the transducer, the change in the pressure creates a change in the resistance or conductance in the Wheatstone bridge. And this change with every pulsation is analyzed and it's given as a waveform and a number, giving the patient's blood pressure with every beat to beat of the heart. So patients in the ICU or patients in the critical conditions are having major surgeries, patients with sickness, this invasive pressure measurement is used. And the principle involved here is Wheatstone bridge and the strain gauge principle. And this, we use it in every day-to-day in our anesthesia practice. And the other common thing, electrocardiography. Here is nothing but what is an EKG. There will be like kind of few scribbly lines on the graph like chart on the EKG. So it is nothing but an electrical activity of the heart. Each myocardial cell is nothing but an electrical unit. It generates electricity, and it's conducted through the heart in a synchronized coherent way, so that when the electric current passes through the heart and each cell, then it contracts, the muscle cell contracts, pumping the blood out. So what we do in this EKG is like we record the electrical activity heart, we put the electrodes on the left image we see, and the like a plus minus put on the around the patient's chest, where we put on the electrodes and we record the electrical activity. So when the electrical activity flows towards the electrode, it shows us a positive deflection. If the electrode is placed in a location where the electrical current passes away from the electrode, it gives us a negative deflection. So in the right picture, we see that the PQ or ST waves, these are nothing but the electrical deflections recorded, electrical activity recorded according to the direction of its flow. If it on the P wave, it means that the electrode is in a place where the current is flowing towards the electrode. And the Q wave is like it's located in a location where the electrical deflection, the electrical path is away from the electrode. So a normal heart creates this normal pattern. When there's change in this electrical deflection, it means that there is some disease process going in the heart. That is why by doing an EKG, we will be able to identify what's happening, and we will be able to treat accordingly. And similarly, when I mentioned like every myocardial cell is a electrical unit, and it generates, and there's one chief cell, which is sinoatrial node, where it initiates and the rest of the heart follows along with it. When it fails, when the electrical activity is not initiated, we could do it artificially. We put in a cable, like to put in a simple word, and we have a pacer device with a battery. What it does is like it goes and it stimulates the heart at the set interval. Like let us say the normal heart rate is 72 per minute. So we could program this device so that when the heart fails to initiate the electrical activity and initiate a contraction, this device will do that. That is nothing but the pacemaker. And similarly, when like others, the heart, how if it does not generate the electrical activity and if it does not contract, we put a pacemaker. The heart could also sometimes go haywire. The electrical activity is like kind of like how it happens in a short circuit, like it becomes like kind of irregular, crazy. So heart could also go that way. When that happens, like to simply put it in a simple terms, when the computer hangs, what we do, we just shut it down and restart it. So something similar, we could give an electric shock to the heart. We might have seen in the movies like putting two pedals on the chest and giving an electric shock. Similarly, by giving this electric shock, what it does is like it stuns the heart, so that all the electrical activity is interrupted by this current. And once it's interrupted, then the heart could start initiate the new rhythm from itself. So that is defibrillation. So recording the electrical activity is the EKG, and the changes in that gives us the idea of what disease process is going on, and either to pace the heart when it's not functioning, or to shock the heart when it is not like when it's going very irregular. That's the defibrillation. So here the electrical current is used in treating the heart. And similarly, electroencephalography, like how we record the electrical activity of the heart, we could record the electrical activity in the brain. So by placing electrodes all over the brain, based on which location the electrode is placed on the head, it gives us the wave pattern. And the wave pattern varies based on when the patient is awake, or when the patient is quiet, or when the patient is sleeping, or whether if there are any other abnormal electrical activity in the heart. Let us say the patient is having epilepsy, the convulsions. So this, by recording this, we will get to know an idea from which part of the brain it is getting generated. So it is electroencephalography. It is nothing but recording the electrical activity in the brain. And there are many other physical and mathematical principles involved in it. So when we are recording this electrical activity, these are in microvolts. There will be a lot of artifacts involved in it. So by recording it over a period of time and by averaging it with the first Fourier transformation, it gives us the final waveform by eliminating the artifacts and giving us the final thing which we could clinically interpret. And this is about the electroencephalography. And so these are all the various clinical scenarios where, and this is just like a tip of the iceberg, where I picked up each one here and there, and with a clinical scenario to talk about where the physical principles are utilized in the clinical medicine. There are many more to discuss, and each one, if we go in detail, it will be further elaborate and exclusive, which each one topic, as I mentioned before, will take a day to discuss. So I try to get a brief clinical overview of the physical principles involved in the clinical medicine. And I think I'm done with this. And these are the references. And I should thank Google for stealing all the images. So that I used all the presentation. And I appreciate every one of you for listening one whole hour. Thank you very much.
Thank you, sir. Thank you very much. As people of physics, I think we don't have handled all these instruments and everything, but as a doctor, you are dealing with all these instruments in your daily life.
All
Thank you
right.
for connecting the physics with medicine.
Thank you. Thank you. It's my pleasure.
Yeah, no queries so far, sir, because everyone have appreciated your information.
Okay.
So,
Okay.
I know probably it might be kind of too much of information squeezed in. I try to, I hope I was a bit slow and relevant.
Mahalakshmi, ma'am.
yeah, okay, ma'am. Very good evening to everyone present here. First of all, we, the team, would like to thank the Almighty for the constant care, grace, and guidance. On behalf of Department of Science, St. Joseph College of Engineering, we would like to express our sincere gratitude to our beloved chairman, Dr. B. Babu Manoharan sir. We are highly enjoyed by his performance leadership. Also, we would like to express our heartfelt gratitude to Managing Director Mrs. S. Jessipriya ma'am, Director Mr. B. Sachishekar sir, our beloved Principal Dr. Vaddi Seshagari Rao, Dean Dr. B. Parvada Vadri ma'am, for all the enduring guidance and support on their absentia. Our head of the department have been encouraging and very supportive throughout the planning and implementation of this FDP. We as a team would like to thankful for the convener, Dr. V. Nandini Devi ma'am. It's been a great privilege to have a speaker like you to share your perspective. You have an inspiring personality and gain detailed information about how physics is closely linked with medical field. This session make us more fulfilling. We hope this session helps to develop more interest in biomedical application. We have a lovely time with you, sir. I once again thank your speaker for sharing his precious time and gracing this feedback FDP program with the perspective. Thank you, sir. We
Thank you.
happy to have we happy to have each one of the participations and thank you for all your encouraging support. Stay strong and stay healthy. Thank you one and all. We will meet you tomorrow by 4:30 p.m.
Sure.
Sir, thank you, sir. One query has been posted.
Right.
Can I show you that?
Absolutely, please. Yeah, essentially, hemodialysis is nothing but the renal dialysis. It's the same. Hemodialysis, it means that they're dialyzing the blood. Renal dialysis is what renal is kidney. What kidney does is it does a hemodialysis inside of our body, and we are doing it outside with a machine. And when we mention it as hemodialysis, it's a kind of a broad term. We might be dialyzing, like essentially the component, the idea involved in it is like we are dialyzing the blood. It could be either for removing the toxic substance or to remove the toxic substance. Let us say a patient is poisoned and we need to remove the toxic. Not every poison is removed from the hemodialysis, but there are certain poisons which could be removed by hemodialysis. Like say the patient is poisoned with like high amount of magnesium and there's extra amount of electrolytes. It could be dialyzed and removed. So hemodialysis, renal dialysis, I would say it's synonymous.
Yeah, thank you, sir. Thank you very much for taking your time with us, sir.
It's my pleasure to join every one of you. All I wish is like it was a bit informative and somebody could take some message home from this 1 hour. Then the
Yeah,
purpose is
sure, sir.
achieved.
Thank you, sir. Thank you very much, sir.
Thank you. Everybody have a good day. Take care.
Have a great day, sir.
I'm disconnecting now. Okay. Thank you.